Hey, what's going on? Dr. Ben Brown here. Let's talk about low back pain. So, looking at the low back, you have the lumbar vertebrae, the sacrum at the base of the spine, and then the pelvis, which wraps around. You have typically 5 lumbar vertebrae, so L1, L2, L3, L4, and L5. In between the vertebrae, you have a disc, which allows us to bend and move. Now, that disc is kind of a cushioning for the spine, allowing us to have motion. You can also have some degeneration. You can have some herniations, that sort of thing. We won't go too deep into that today. Just want to go over some basic causes of low back pain. If you have a real concerning issue, then see your doctor, see your chiropractor. If I'm your chiropractor, come see me. We'll figure it out. All right, back to the back. So off of the spine, you have these nerves that come out. You have the spinal cord in the middle. Off that comes the nerves, go into the extremities, giving us sensation, giving us pain sensation, allowing us to move. So when you have compression of those nerves, it can affect your motor control, your sensation, can cause some pain, shooting down the legs, that sort of thing. So going back to this, let's first start with the disc. So you've probably heard of a disc herniation or a disc bulge or a slipped disc before. Very, very common occurrence. So what happens with that is, like I said, allows us to bend and move. You end up getting micro tears in the disc, and eventually those micro tears will become big enough that the fluid inside the disc can then come out. Sometimes that fluid will irritate the nerves, again going down into the legs, cause sciatica or that type of symptom. So that's kind of a brief, short version of a disc herniation. You can also have some bulging of the disc and that sort of thing. Most of the time it does not require surgery, so don't let that scare you if you have some imaging that maybe shows a disc herniation. Sometimes it does, but most of the time it can be treated conservatively. Okay. On top of that, we'll go down to the joints in the back of the spine. So if you look back here, let's see. If you look back here, there's a joint here on each of these levels called the facet joints, and that kind of supports the weight in the back. I like to think of it like a tripod. So you have the 2 facet joints in the back and the disc in the front, and they kind of hold our weight on that tripod. So in the back here, the back portion of the spine is the facet joints. Now when those get irritated over time, it can cause what's called facet hypertrophy. So wear and tear over time of bone, it's going to make more bone, so creating essentially arthritis in the area, and that when that happens, it can close off those holes again that those nerves come out of. So that would be a stenosis patient, if you've heard that term before. You can also have stenosis of the central canal. Okay. Now you might be wondering, when is low back pain concerning? When is it really something that needs to be looked into? So that's the case of any red flag. So if there's a trauma, whether it's a car accident, a fall, that sort of thing, and then you have low back pain, definitely need to get evaluated. Okay. If you have a fever with low back pain, sometimes that could be associated with an infection of some sort. Again, need to get evaluated. Now, if you have changes in bowel or bladder function, that could be signs of kind of impingement on those nerves that go to the bowel or bladder, and that needs to be evaluated, because that prolonged, if that's not dealt with soon enough, it can create long-lasting effects. Okay. Unexplained weight loss. If you're not trying to lose weight, you've lost weight recently and you have low back pain, that's concerning. Could be a sign of cancer. If you have a history of cancer, that is also concerning. Okay, because we don't want that to come back and cause low back pain. All right. Next, let's talk about 3 things you can do to eliminate or reduce low back pain. So again, I'm going to be kind of broad with this, hoping to get some of you reach out, ask me some more specific questions, and we'll kind of dive into deeper topics as we go. But just for this first video, I wanted to be broad and kind of explain a little bit about the anatomy and causes of low back pain. So with low back pain, I think the biggest thing for most people, you need to move. So you need to move into your old age, move throughout your life. If you're sedentary, you're going to have more low back pain, and that's just, studies show it left and right that you sit still all day, you're going to have more low back pain. Okay, I don't think you need to be running a marathon or anything like that to eliminate it, but staying active is what we're made to do. And actually, the disc doesn't have the best blood flow, so movement is what flushes that nutrition in and out of the disc. Okay, so number 1, stay active. Number 2, get stronger. So to prevent strains and sprains doing simple things. I think we need to train our bodies to do more complex, more difficult things over time. Now, do you need to deadlift 1,000 pounds? Absolutely not. But I think we're deadlifting multiple times throughout the day. You might not realize it, but every time you sit down on the toilet, every time you bend down to tie a shoe, you're going through those motions. So I think some weight training is great for most people. If that's not an option, then there's a lot of body weight exercises that are great to build resiliency in the low back. And last but not least, to prevent or eliminate low back pain, work on mobility. Now, I think a lot of low back pain stems from poor mobility in the hips. So again, if you're bending a lot throughout the day, those hips don't work, that low back is going to have to compensate. So work on the mobility in the hips, and then kind of going back to that getting stronger statement, building stability in the low back is a huge thing. So shoot me an email, I'll send you some exercises and stretches for the low back. If you have a problem that is concerning, definitely go see a provider. If you have something that's even bothering you, then go get it checked out. I don't think low back pain should be ignored at any level. I think if it's something on your mind and you want to get it taken care of, go see somebody. If I'm local for you, then come see me. Let's get this figured out. And thanks for watching. Stay tuned for future webinars. I know this was pretty short, but hopefully you got some info out of it. Feel free to follow me on Instagram at doc.bbrown and on Facebook at facebook.com/Brown Chiro Swansea. So my office is in Swansea, Illinois. Again, thanks for watching, and I'm Dr. Brown.